has to be taken seriously. A study revealed that 8 out of 10 people have had back pain at some point in their lives. When we stand, the lower back takes the major brunt to support the weight of the upper body. When we bend, extend, or rotate at the waist, the lower back is predominantly involved in the movement. Therefore, injury to the structures important for weight bearing, such as intervertebral disc, bony spine, muscles, tendons, and ligaments, often can be strained and stressed when the body is standing erect or used in various extremes of movement. Did you know anyone can develop back pain, even children and teens? Today in our live chat, we have with us Professor Dr. Arvind Jayaswal and Dr. Abhishek Srivastava with us. Professor Jayaswal is a renowned orthopedic surgeon and head of Department of Spine Surgery. He completed his master's from the prestigious Institute of AIMS and has an experience of over 25 years. He is a pioneer in rigid and severe spinal deformity correction, minimally invasive spine surgeries, missed disc surgeries, minimally invasive lumbar spine fixation, and minimally invasive scoliosis correction. He is known for the management of all types of spinal disorders and back pain, specializes in spinal injuries for deformity correction, degenerative spine, spinal trauma, and spinal tumor. Good afternoon, sir. How are you?
Good afternoon. It's a pleasure to be here talking to you.
So if you can have your mic, please. Thank you. Dr. Srivastava is a well-experienced consultant spine surgeon. He has received long-term hands-on subspecialty training in the field of spine from various Indian and overseas centers. We are here to take up all your queries on spine surgery. Let us begin with a few important questions on spine disorders. Why do we get back pain? Why is one's back vulnerable to pain and injury? What do you think about it, sir?
If you go back to evolution, right? Human beings evolved, as Darwinian theory goes, from apes, right? So we were four pedal creatures earlier. That means we walked with on all the four limbs, right? Slowly, we evolved into two pedal gait. That means we started walking on 2 feet, right? But we evolved very rapidly if you look in terms of years. But the development and evolution of the back and the muscles did not evolve so rapidly. So this is one of the price which you pay for an erect posture, number one. And if you look at the modern age, this is the price that we pay for modernization, for inactivity, for comfort living.
Absolutely. Okay, so why do we have such a common problem such as back pain, and then it gets prolonged, then we need to go and get ourselves tested? Why do you think it is such a serious problem?
Because, as I said, we are getting more and more modernized, right? Our activities level has gone down. So, an average middle-aged person who's going to the office, young adult who's going to the college, get up late in the morning, they rush to the office or the school or colleges. They go in cars, so they're not exposed to sunlight, and then when they get off, get into an AC office, go onto the desk, slouch posture, works on computers, and then the whole day they're in the office, and then they come back home, watch TV, go to sleep. So where is exercising coming in? Where is activity coming in? These are the prices that we are paying. Sedentary habits, modernization.
Absolutely. Thank you, sir. Dr. Abhishek, what do you think are the common causes of back pain?
As sir has already pointed out, the main causes of back pain are most of the time it's the mechanical. it's a result of inactivity, bad posture, not taking care of your back while doing, daily activities or, doing things when you are not prepared. So mechanical is one of the major causes, and then there are some sinister causes which you have to take care. But thankfully, they happen in a small number of population, which can range anywhere from infection of the spine, metabolic disorders, and then very rarely there can be tumors as well. But thankfully, predominantly it is more of a mechanical, postural, and lifestyle issue.
So could stress be also a factor of back pain?
Oh yes. Again, a question of lifestyle changes and stress. Obviously, when you have a lot of stress, it shows organically also. So a person who's stressed, who's depressed, who has a low threshold, they get pain. Once they start getting pain, it becomes chronic, then they become further stressed. And then there's element of depression comes in, and that adds on. So it's a vicious cycle, what we call psychosomatic angle of organic problem. And back pain is known to be very well associated with stress factors as such.
Absolutely. So you just mentioned, because of our lifestyle and the traveling that we do so often, that has become a very, very common factor for back pain today. So what do you think are the precautions one should take to, take care of your problems that you would encounter because of traveling?
Okay, so, since the dawn of this jet age, we are doing longer travels.
Yes.
And longer travels mean sitting in the same posture for a long period of time, which intuitively will lead to fatigue of muscles and general fatigue as well sets in. So your muscles become more prone to injury, and also it puts pressure on the structures which support the spine. So the structures have to support the weight of the body in an awkward position. So that is the basis of why traveling leads to injuries. So the basic idea is to de-stress the spine intermittently. That means give your back a stretch, every half an hour or so, or maybe, whenever the time permits, so that it gets time to recover from the brunt of the travel. So
and most of the time we are traveling, we're sitting in a slouched position. Like this.
Yeah.
That's not good. Your spine has to be raked. It has to be raked, and then there'll be a 90-degree angle at joints, and that's when your spine is at its optimal efficacy.
Nowadays people take these spine supporting cushions, and there's something that gets stuck to your car seat. Do you think that works, or it damages your spine even more?
Like we were talking about the mechanical sort of axis. The spine has bends, right? It has curves. When you look at from the side,
Yes.
it has a lordosis in the upper level of the neck.
Absolutely.
So it's a cervical spine. And then in the middle level, which is called the thoracic spine, there's another curve which is called the kyphosis. And in the lumbar spine, the lower spine, there's again a curve which is called lordosis. So all these curves have to be supported. The spine has a curvature to distribute the loading of the spine, and that has to be maintained. For example, when you slouch like this, the lumbar spine, which had to be in a lordotic manner, becomes either straight or back. So that stresses your muscle and your ligaments for a long time. And if it is in position for a long time, then they become weak, and they're loading up the facets and other bones, and that's where the pain comes in. These are the causes of mechanical back pain, which Abhishek was talking to you about.
Yes, absolutely. We have a question from Rahul Sharma, one of our viewers. He says, will fusion surgery lessen my neck mobility?
Yes, Rahul, a good question, because your mobility comes from your upper spine, which is the cervical spine, the neck, and the lower spine, which is called the lumbar spine. The middle of it, the thoracic spine, has ribs anchored to it, so it does not move to that extent. So cervical spine and lumbar spine is very important to maintain the mobility. So when your fusion has to be done, that is the problem, that all the segments do not move. Having said that, in the cervical spine, there's 7 segments, there's 7 motion segments. So if you're doing a discectomy, for example, and you're going to do a fusion, then 1 segment would go, but the other 6 are moving. So to get something, you have to forego something. So fusion does alter your mobility to some extent. But if you look at the overall mobility, if you're not fusing the entire cervical spine, entire neck or the low back, then you still have mobility.
Thank you, sir. What is sciatica, Dr. Abhishek?
Okay, so sciatica is a very common term which we use to describe any pain which is going down into the leg, and it is of shooting in nature, or some people describe it as a stab in the leg, or electric sensation, pins and needles. It is usually in the distribution of a thick nerve which comes out of the lumbar spine, which is called a sciatica, which consists of all the major nerves in the lower part of the back, the lumbar spine. So most commonly the sciatica happens because there is a pinching of one of the nerves because of the herniated disc. I mean, the disc which slips, comes out and irritates the path of the nerve. I mean, irritates the nerve by reducing the diameter of the path of that nerve. So that is the in common parlance, the sciatica is the pain which is there in the leg. But there are many etiologies. I have just highlighted the most common one and the basic one.
The origin of the term, I mean, the viewers like to know, is sciatic is a thick nerve, as Abhishek told you, in the leg, starting from the buttock region and going down all the way to the leg. So sciatica, the term came from that is irritation of any portion of the sciatic nerve which causes leg pain.
Okay. Thank you, sir. It's one of the questions from Arushi Dixit. She says, is it true that only surgery is required to treat most cases because of the back pain?
So, initial, the response or, advice to people who have got back problems is that, in our practice and the standard of care is that we try and let the body heal on its own by, supportive measures like medicines, like physiotherapy, like exercises. And the good part is that the natural history means if we don't do anything, what's going to happen? Then it heals in most of the people. We are just there to support that process and nurture that process. And that is what our intention is. So surgery is not usually the first line of management. It only comes into the scene when, the conservative care fails. So, that would be the answer to her.
All right. I hope, Arushi, your questions were answered. And according to you, what is the best treatment for sciatica pain?
Like Abhishek said, most of these back problems and leg problems, sciatica arises from the problem in the leg, and then on the back, in the back, and then it goes down to the leg. So the basic problem is in the back, the disc herniation or the stenosis or any infection or a slip. So that has to be looked into. And majority of the problems in the back have to be initiated with conservative methods. That means painkillers, analgesics. That means physiotherapy. You have heat therapy, and you also have exercises. So you give them a good trial of conservative method. If that fails, then you have to go for surgery. Right.
So I hope you got the answers to your question that surgery is not the first and the only solution for a back pain. We look at conservative methods, we look at physiotherapy, we look at medicines which can work and help you cure your back pain. Now, what are the red flag signs, so to say, that one should be aware of?
So this is something which anyone who is having back problems or in the common society should be aware of. Right? So if a back pain which has got some element of fever, along with if there is any weakness in the legs, that means there is loss of movement in any of the muscles or of the limb, along with any problem in passing urine or motion, or if there is numbness in the private parts, So these things are to be taken very seriously, and the consultation of the concerned specialist should be taken as soon as possible. I mean, these are not the signs with which you should sit at home. Yeah, you need to go and consult.
Also, these red flag signs, so-called red flag signs, yeah, these are indicators in many cases for urgent surgery, like what Abhishek said, that if the patient is having problems in passing urine in stool, if there's numbness in the private parts, and if you're you have inconsistency, that means you pass your urine without knowing it. So this means that your bladder and your bowel is getting affected, something like that, and that becomes an emergency. So if you have these red flag signs, then you have to immediately respond to emergency. So the importance of that. Similarly, if you have the first viewer asked about the neck problem. If the neck problem is there, then the first sign of first so-called red flag sign would be if you sort of your handwriting starts tapering off, you don't sign, the signature goes, or if you have an unstable gait, which means if your spinal cord along with the nerves in the neck is being compressed, and that becomes a serious problem.
Very serious problem.
So then that needs to be looked into by the specialist, as you said, go to the emergency, and more likely than not, would need surgery.
Your vision also get delusioned, when you're suffering from any of these back problems or maybe a neck problem. For the people probably who are driving,
It is one very unusual to have, visual problems with, axial back pain. So I think I would recommend the person to have, being evaluated by an ophthalmologist, and certainly he or she should not drive till the time that is cleared off.
That is clear, absolutely. Okay, well, one of another viewers, Nitin Singh asks us that I've been suffering from back pain, and the doctors told him that he's got degenerative disc disease. So he also said that he would require surgery later. He wants to know that, what should he do? Should he go for surgery? What are the preventive measures he should take regarding the degenerative disc disease?
As the term implies degeneration, it means it is a semi-medical term for aging, right? Just like hair become grey, that's one of the indicators for aging or degeneration. Then hair become grey even in middle-aged people, even some young people. So the degeneration occurs predominantly in the disc, which is like a washer between two vertebrae. Right? So that can occur not only with age, but can also in younger patients if there's stress to the disc or if there is injury to the disc. So when that happens, it's a slowly process, like what Abhishek was talking to you about. There's a natural history to that. So it starts first with a tear, then it may come out, and then the back joints get affected. So it's a ongoing process which happens. So it depends where you are, in what stage you have. So as you very rightly in the introduction said, if the back pain is prolonged for more than say 3 to 4 weeks, then you should better start getting serious about it, and you go to a specialist, get yourself investigated.
Investigation is what is coming to.
So clinical examination and investigation by a specialist. So just don't pass it for back posture and then randomly go and start doing exercises, or just think it is mechanical back pain. If it is persisting for more than 2-3 weeks, then you better get yourself examined.
It's a serious thing.
And then what state of degeneration it is, the treatment will depend on that.
Absolutely. I have Nitin, your query was answered that you need to consult the doctor and get yourself, you should know where you are in your degenerative disease, and according to that only we will, run some investigations, and you need to get a consultation, and only after that would you actually get your answers. Now, you spoke about the conservative options to deal with back pain. We just throw a little bit light on that. So, in detail, what are the conservative options that one can go for instead of surgery to deal with back pain?
Okay, so as we had told you earlier in the conversation, that conservative treatment is the first line. So it involves, if there is pain, treat the pain, the symptom which is there. So we can give them pain medication so that they are comfortable with the pain levels. And then, once the pain allows them, we allow them to move, at least mobilize, go to the toilet, move around the house, and then gradually they can get on with their activities. We do not recommend, strict bed rest and things like that. So that is something which is part of the conservative care. Along with that, you may take, depending on how you feel about. Some people are happy with the hot packs. Some people are happy with the ice packs. So that can help them. So you have to pick your own. But usually we recommend, if it is very early, then ice packs. But most of the people will come after a few weeks of taking treatment at home. And the other option is that we can start them on physiotherapy, to treat the basic cause and also to help support the muscles. That will also take some time for them to build up. And there is another option which comes somewhere, it's not truly conservative, it's not truly surgical, it's something called as nerve root blocks or injections. These are something which help in two ways. They help break the pain cascade so that you can participate better in these conservative care methods. And sometimes, they can be therapeutic, taking care of the chemical component of the disease, especially the sciatica or PIBD after doing the adequate diagnosis and then this is one of the treatment modalities. This is not a true surgery, and also which is not a true conservative care.
So do you think these work? What is the percentage of patients who've actually
I would reckon that about 80 to 90% of people will respond to conservative care, and if they continue with back care and follow the precautions which have been advised, then they should be doing well and go back to what they were doing. Right? Because back pain has got a very high relapse rate as well. That is about 70% of people will get another attack if they don't stick to the advice of the doctor within a year.
Okay. Thank you, Dr. Abhishek. Some of our viewers, I hope your question is answered that there are a lot of conservative methods that you can adopt to heal your back pain without surgery. And another viewer here, Mr. Anil, wants to know the reason for back pain going to legs. Anil, like we mentioned earlier in this chat, there's something called sciatica, and sciatica is predominantly the reason for your back pain to travel all the way to your legs. So I hope you could refer to our chat before and your question will be answered. Yes, and so when should one consider themselves for surgery? When is that decision that one should take that it is better to go for surgery and not stick to the conservative methods?
Well, the decision has to be in consultation with the specialist, number one.
Absolutely.
You please don't take the decision and leave it to the specialist, because otherwise, you may undertreat yourself or overtreat yourself, and that's not going to be good. So first and foremost, as Akriti rightly said in the introduction, you give yourself for 2 weeks or so. If it is persisting, see a specialist. When the investigations and things are done and your diagnosis is more or less in order, then as a specialist we start on conservative management. As we discussed earlier, a good many percentage of the patients would respond to conservative management. Right? Now, if in spite of the adequate conservative treatment, now everybody will ask what is adequate. 4 to 6 weeks of conservative management, still getting the persistent pain, still getting the leg pain, and if there are red flag signs that we discussed earlier, then these are become the indication of surgery. Intolerable pain in spite of not getting relief by analgesic, not getting relief by physiotherapy for more than 6 deteriorating nerve disorders, nerve problems, or if there's bladder bowel involvement, these are the conditions these are the indications where you need to go into surgery. Not a common back problem like a disease, disc disorder, or stenosis.
So we spoke about the minimal access spine surgery. Would you like to let our viewers know what exactly is a minimal access spine surgery? What are the advantages for it?
So, as the name suggests, Akriti, minimal access spine surgery. So that is it. It tells the story in itself. So minimal, that means a very small, approach-related incision for accessing the spine. So we try traditional methods involve, erasing the muscle from the bone in order to reach the area of interest, along with a big skin incision. So we are trying, as everyone evolves, we try to minimize the collateral damage in order to do what we are supposed to do. So it is just one